When we look at treatments, I judge it on two things. Does it reduce your pain in the moment? And then does it improve your tissue capacity over the long term?
Welcome back to another episode of Past Your Prime, the podcast for active adults balancing training, rehab, family, and real life. I'm Alex Keicher, pro volleyball player, working dad, and injury connoisseur, here with my favorite physical therapist, and soon to be once again my coach, Craig, the PT Smith.
I'm actually very excited to be your coach again.
Can we insert the Rocky music there, maybe?
I will absolutely insert the Rocky music.
Yeah, let's talk briefly about you being my coach.
I have said over and over again that Alex has the worst instincts when it comes to making his body feel good. And I'm going to put my money where my mouth is on that and take over your programming.
I'm coming off a week of doing pretty much nothing at the beach. I walked over 10,000 steps a day. That's probably the only somewhat fitness-related accolade that I accomplished while there.
Well, I think that's a good thing. I think last time, if you guys remember, he went on a run and I think irritated something while running on the beach.
I think my legs were about to fall off.
Well, so it's very similar to the topic that we're going to talk about today, where Alex doesn't have an issue with carrying out a plan. It's just sometimes the plan that he selects and sets up for himself is a horrible decision.
Coming off our last episode, we went to the zoo and I think I walked like 20,000 steps that day. My shins hurt and I was like, shin splints. These must be what shin splints feel like.
This is a shin splint.
Yeah.
So you have now had that, which is good.
Yeah. Thank you. Thank you for doing that to me.
You're welcome. I like to do that to him, guys.
Okay. So today we're going to break down a topic that we've talked about before, but not in terms of relief strategies. Low back pain.
I would like to get really granular on it. If you're dealing with recurrent low back pain, which is really the big issue, if you have acute low back pain, which is the first time you've had it and it just started, it's really severe and it's self-limiting, oftentimes those will heal by themselves. You almost don't have to do anything for them. But the real issue is the one that keeps coming back, that recurrence where it seems like no matter what you do, you're always on edge to have your low back issue come back again. That's what today's episode is going to be more focused on.
All right. Let's just dive in then.
Okay.
I think the first thing that you wanted to talk about, which we've talked about several times, is tissue capacity. Not Kleenex, but your muscle tissues.
Not Kleenex. Tissue capacity for me is such an important thing for any person who's dealing with an injury that keeps on coming back over and over again. You've heard me call it a doom loop. But anytime you have it over and over again, and it almost seems like the frequency of that issue keeps on coming back at a higher rate, that means that you're not actually targeting tissue capacity when you do your rehab or even when you go through your training. The idea with tissue capacity, I think you have to always think of it in relationship to the other two that I've talked about, which is energy capacity and physical capacity. When we say tissue capacity, we're saying what can your body handle and still have a good response to it. Right. And when we do tissue capacity, and there's one way to think of it is it's pain relief, but I actually don't think that's the most important part. It's more that you can handle more stress and feel less symptoms. And so the pain relief is actually not a one-to-one. And I think that's why sometimes people get stuck with this is they'll do things that make them feel good for the moment, but it doesn't ever actually increase what they can tolerate. And I'm always doing my hands thing. So it doesn't increase what you can tolerate. So if you're just doing things that it seems like it reduces your pain, but it never actually makes it so you can do more, you're not building tissue capacity. It's just really important that you understand that that is a key for long-term management.
Well, and I think, especially with your back, like you're probably using your back, and I go back to like the hidden triggers. You don't know what times you're tweaking your back unless you're doing, heavy deadlifts or something like that. There's probably some obvious triggers there, but I think the low back is one that can be quasi-mysterious in terms of what is causing your low back pain. And so probably identifying first and then being able to find the right therapy, short-term and long-term, are probably all key here.
You bring up a really good point. There's three things that I think for you to develop a really, really clean strategy targeting your tissue capacity, you have to know what your triggers are. Some that are super common, and how Alex just said it, we can split them up into obvious versus hidden. And the obvious triggers, you already know what they are. The hidden triggers are the ones that I think trip people up because you don't even know it's a problem. Then you want to know what treatments actually make you feel better. In this one, we're going to make a special mention today about symptom maskers. I just want to go over and clarify our position on it. But when you go through the treatments, you want to verify that they actually increase tissue capacity. And sometimes that can actually be more tricky than you realize. And then the last thing is understanding really clearly what your feedback loops are. What tells you it's going well, what things tell you it's going bad. And even if there's a way for you to be able to screen it before you have your normal back blow up.
Back blowout.
I knew you were going to say that. Ridiculous. But those are the big pieces I want to make sure we hit today.
Okay. So it's kind of a balance between building your tissue capacity and then also maybe backing off because you're looking to increase your treatments and decrease your triggers.
Yes. If we go into triggers first, I think that you really need to understand your triggers. Sarah's my wife, also a physical therapist. We were just talking about this aspect of management. And we were saying like one of the things that we notice is that right now we have a medical culture that really pushes treatments. And so you have one side of the equation that gets hammered all the time, like go get PRP, go get an epidural, go get stem cell. And it's this gigantic amount of procedures that you can do. Makes total sense. You get paid for doing those procedures, but you don't really get paid the same way for going through somebody's trigger management. If I had to pick an area, if you've been dealing with this for a really long time, that most people are missing, you've never managed your triggers well. And if you don't manage your triggers well, you're just hoping that you can outrace with your treatments the triggers that you're generating.
Yeah. That's been one of my big goals in the last, I don't know, I'll call it 2 months now because I've been hurt the last month and haven't been able to do anything. But
let's be honest. So this is literally the reason why I'm going to take over your programming. But it's because you will literally try to do workouts that are triggers. You don't realize that at this point, and you may not believe me, but that's my biggest issue.
And you want me to be a success story, and I've not been.
Dear God, I was actually wondering if anybody listens to this and they're like, Alex is a walking mess. Yeah.
Yeah. That's why I moved to injury connoisseur. I've moved beyond the Hall of Fame of injury collection.
I actually have people come in here and they're like, so Alex. I'm like, yeah, Alex. Yeah. They're like, what? So what? Is he okay?
No,
he's going to be fine, guys.
No, I roll my ankles walking up the stairs. My back hurts if I drive for too long, like I did yesterday.
There we go.
Yeah.
And that leads us really well into the most common triggers for your low back. Sustained positions, I think, are, if they're not the top one, they're one of the big ones that I always look for. What Alex just mentioned is sitting. How long were you in the car for?
6 hours with a 45-minute break.
And did you feel it? How long into it before you felt your back?
Just when I got out of the car.
Yeah.
Yeah.
So I think that the part that's the most interesting with sustained positions is that you don't get the feedback loop. And that's the one that I always look for first. People will tell me that they're in a position for a long period of time, and it can be standing or sitting. And then it's when they get out of that position, they're like, I'm not sure what caused it. It's like, well, it was the hours that you spent in that same position.
Yeah. And my hamstring hurt afterwards too. I was like, this is crazy.
Do you think it was a referral, or do you think it was from your back?
Yeah.
That's like one of the biggest things is like with the low back, you can't always confirm the location, right? Like so referrals are really common with low back. Not what we're going to get into today, but that's a big one to know. The next one would be repetitive movements. So it's not that you're in a sustained position, it's that you do something that's provocative over and over and over again. Walking, for example, you go into these like small cycles of extension and flexion in your lumbar spine. That can be something that's really provocative.
Could be as simple as like shoveling some rocks, or if you're gardening, or doing 300 deadlifts.
If you're doing 300 deadlifts,
increase the load
a little bit, maybe reduce the reps if that's the problem. The next one that we're going to talk about, this is one that really leads into hidden triggers, and those are interactions.
Like the hamstring one I just talked about.
Well, so the hamstring one, That would be a
Referral.
referral.
Okay.
An interaction would be where you do one thing and then another thing, and those two in combination cause it. So it could be sitting followed by exercise causes your back issue to develop, or exercise followed by sitting,
Yeah.
right? And that actually leads to one of the most common things that we see when people are working professionals is that they'll have exercise first thing in the morning and then they'll go and do their job, and it's literally the timing of their workout that's causing the problem. You can also have where people get, I think they get provoked, they do exercise and then like how you're doing it later at night, and it's the exercise followed by sleep that causes the issue. So there can be a whole bunch of different interactions. You just have to figure out which thing is the driver. So you can do, obviously, you're still going to sleep, right? So you can take and change the timing of the exercise during the day from end of the day to maybe the morning. And if that resolves your symptoms, it's clearly not the workout that's causing it. It's clearly not the sleep. It's the position of the two together.
I don't like to work out in the morning, so I'm not going to do that.
I actually don't recommend, if I'm going to pull an exercise routine out, like and change the time of day, because of how the discs work in the low back. I don't like to have people exercise first thing in the morning, or if they do, I'll have them do stuff to dehydrate the disc, like a walk for 20 to 30 minutes before they actually exercise.
That's interesting.
Yeah.
At least they're working out, so don't steal their thunder.
I'm not going to steal your thunder. You can still do it. You just need to know that it's an actual trigger.
Like, would you have them walk first and then work out?
Exactly.
Oh, okay.
Exactly. But if you don't dehydrate the disc and you immediately you do your warm up and go into a heavy deadlift or a heavy squat, your disc is actually more hydrated first thing in the morning. So you're going to be dealing with higher disc pressures. So you can absolutely irritate yourself.
Don't want the triggers.
No.
Okay. What else influences?
The final one that I want you to dig through is just regional influences. So this is the one that I think if you go on and you look for treatments for the low back, a lot of them are actually going to target these issues. But I look for regional influences as triggers. So that could be inhibitions at your glute muscles, loss of motion at your hip joint or in your thoracic spine. Those are really common regional influences that then can lead to other things becoming triggers. It's not so much that you're going to feel pain at your hip or you're going to feel pain at your upper back. It's that something's happening there that's driving more load and more force through the lumbar spine, which then makes you more prone to developing reactions to some of these common trigger positions. So it's just a good one to note that you may be feeling at your low back, but it's actually not the cause.
And I've become just more in tune to like thinking about all of my daily activities and could what I'm doing currently, just the way that I'm sitting right now, could that be a trigger? Could the way that my arm is positioned to be a trigger? So talk a little bit more about kind of how you should think about your triggers during the day if you're experiencing back pain.
You should really look, in my opinion, you really want to figure out your feedback loop. And the feedback loop is just after you do something that actually irritates whatever structure is hurting your back, how long does it take for you to get the signal from your body? And that is not consistent for everybody. Even with a very, like literally the same injury, it's not consistent. It could be right after you do it. We call that a level 1 tissue response. So if you do the activity and you immediately get pain from it, you know what just caused it. And it's like fast and it's immediate. If you have a hot burner on your stove and you put your hand on it and it burns you, you know what just caused it, right?
Was it the burner?
It's probably the burner, especially if you have like a burn on your hand now. Your sensory system in your hand is very dense. And so it can give you really good information immediately. Your low back, especially the deeper structures in your back, are not like that. So those deep structures, unfortunately, they don't give us clear signals. It's really common for us to get delayed feedback loops and to get referrals. And just to remind you guys, a referral doesn't automatically mean it's a nerve that's involved. You can have what's called a somatic referral, and soma for somatic just means body. So you're getting a tissue that's referring. And sometimes people will come in and they think they have a nerve injury because they feel it somewhere else in their leg. But your back can actually refer to your leg because the signals get kind of mixed up during the process of getting to your brain, and you don't know exactly where it's at. So that the combination between the referral and the delayed feedback loop means that you need to figure out what thing's causing it. So if it's not a level one and it's more like a level two, which is you feel it after you get done with a series of activities. Level three would be you feel it later in the day. Level four would be you feel it the next day to maybe 72 hours later. Level five would be at the end of the week. And level six would be normal, which is after a series of progressive overload. It's like a normal program that lasts between 3 to 10 weeks. That's why you always need to have a recovery built in, is because if you progressively overload, at some point you need to give your body tissue time to actually heal and recover. Figuring out your feedback loop, I would say with recurrent low back pain, is the trickiest aspect of low back care, right? You can't always tell what the heck you just did the next day. Like, so I wake up and I hurt in my back when I first wake up in the morning. My first inclination is gonna be, did I just tweak my back at night?
Right.
But to be honest, I don't often see that being the case. So people will buy like a whole new mattress thinking that that's going to solve their problem, when it could be that they sat all day
Or
the
you
day
bent
before.
over wrong, or you squatted too heavy. It could be, yeah,
It could be that
anything
delayed.
you did the day before or even 3 days before.
You got it.
Yeah.
You got it. Well, and even with your own back issue, how big of a delay do you have?
I mean, I haven't had, knock on wood, but I haven't had too many real back problems aside from just driving yesterday, which I think I know that prolonged sitting for several hours is one of my triggers. But like, yeah, it went away pretty quickly after I was able to just get into gravity from sitting.
You have an interaction with your calf though from your back.
Yeah. And I
Uh,
haven't experienced that in like 2 months now.
That's nice. How for you, it does happen in the activity, but the activity has to be longer.
Right. Yeah. So if I'm playing volleyball for 3 hours, usually in that like third hour or second match is when I'll start to feel it.
So I would consider that between a level one and a level two, because you're really getting towards the end of the activity,
Right.
but it's pretty clear what caused it. It's not like you're not looking at your work day. You're like, okay, I played volleyball and I'm playing pretty hard, and this is clearly the thing that's causing my symptoms. Those are really simple to figure out. And that's actually the part where you might want somebody to help you with, is when it's unclear. Like if you're not sure what causes it or you're making guesses, you make changes to your day and it doesn't result in you feeling better, you really want to figure out which of the issues is actually causing it. That's where you might want some help.
Yeah.
Really
And
figuring out your feedback loop.
diagnosis is key there.
It is. It is. And it's beyond what we're going to talk about today, but you really do want to know as close as you can what structure possibly could be causing your symptoms.
Okay. After you've got your diagnosis, obviously you move into treatment. So hopefully more on a little bit of a positive note here. What helps low back pain?
The treatments piece is really interesting. And I do want to make a special note. If you guys remember where we talked about the way to look at a good treatment is it actually improves tissue capacity. And remember, not all treatments cause immediate pain relief. And the most common way to judge a treatment is to say it makes it feel better. And this is one of the reasons I dislike static stretching, is because people will use it as a treatment when actually it's a trigger. It actually causes their symptoms to get worse. But they have initially they'll feel better.
Right.
So let me say that again. One of the reasons I do not like stretching is because when you stretch, you'll get some level of symptom relief, but then it actually lowers tissue capacity over time. So people keep on getting the same problem over and over again. So when we look at treatments, I judge it on two things. Does it reduce your pain in the moment? And then does it improve your tissue capacity over the long term? These are my favorite treatments. The first one's lumbar traction.
And it's basically just putting a band around your knees while lying down, and kind of pulling apart your back. I'm trying to use descriptive words that would help make a visual for our audio only listeners.
I do like that. It'll pull apart your back. Yeah, that's
Yeah.
kind of what it does. Yeah. I mean, and it feels really nice, feels really good. A lot of these treatments, you think that it's providing a lot of mechanical changes, but really it's most likely interacting with your sensory system to reduce some of your pain, which is pretty cool that it helps with the process like that. That's probably my favorite go-to.
Yeah. And I mean, I think there are times where you can overdo it as well. I think it's worth noting. I've certainly been there where I was pulling kind of as hard as I can on my back and I wasn't getting any relief. So like there's a balance to your amount of traction that you're doing. I think a lot of people will use the inversion table to kind of do the same thing. That's just a very expensive piece of equipment that brings a lot of blood to your head when you can just do it laying down with a $10 band.
I do, yeah, but if you like it, there's nothing wrong with it. The inversion table.
I don't like
You
it,
don't like
but
it? I've found that it takes a bit of time to get used to your head.
oh yeah, a lot of time. 'Cause then, yeah, you get off that thing, you just black out.
I love it. The most common mistake that I see with lumbar traction is going to be you do it too hard or you don't do it hard enough. And that just brings us back to the point. You always want to verify treatments. You shouldn't assume that it's going to make you feel better. The next one is that if you do the traction and say you're provoked, like you provoke your back by going into extension, if you do traction, you can pull hard enough or at an angle that causes your back to extend. So then
Mhm.
that'll just provoke your back. So then in those situations, we have people put a wedge underneath their upper back. So they're slightly flexed as they're getting tractioned. And so you just want to verify, as always, with all of these treatments that they actually make you feel better.
Okay, what's next?
Soft tissue massage. I really, really like to address the common issue where muscle tissue gets irritable and it can actually become a pain generator when you have low back issues, especially recurrent low back issues. There's really good evidence actually that the longer you have low back pain, you start to get fatty infiltration into the muscles of your back. So you actually lose muscle quality.
Gross.
Yeah, it can become like kind of fibrotic and not too good. And so giving some level of mechanical input like that can help your body to kind of start the process of healing itself again.
And is this something that you would need a professional for, or is this kind of using that lacrosse ball?
You can totally use the lacrosse ball, but honestly, I think all of these things would work really well if you have somebody helping to guide it. But these are just common tools. Just so if you're at home and you're trying to do some of these things, it's an easy go to.
Yeah.
It's like a really easy go to. I don't like to do it to where it hurts, like at all. Like on this one, I like to use a soft enough input that it may feel uncomfortable to good. I don't like to go so hard that you feel bad. And the lumbar spine is kind of interesting is that if you provide a soft tissue technique where there's a lot of force going from your back, so your posterior to anterior, so from back to front, you can shear your disc. And so I don't like hard pressures. And that, sometimes we'll get some people in who've had like a hard massage over the paraspinals, and that's actually provocative. So you just want to be careful when you're doing the tissue work. You don't have to crush it. Like you're not mechanically changing the muscles. So the whole idea of the harder you push, the better it's going to feel. You run the line of it actually becoming provocative.
And that's the same reason why we don't foam roll our low back.
That's literally why we don't recommend foam roll on your low back. The next one's core control and core coordination. The reason I specifically don't say strength is I don't think most people have a strength issue. I think that they have a coordination issue. When you have back pain and you have it recurrently, your core control system becomes dysfunctional and you may have portions of the muscles. So you have three big ones: your transverse abdominis, your internal oblique, and your external oblique. The transverse abdominis acts as a corset, and when it engages, it provides a stiffness to the spine. And working in conjunction with like your multifidus, your rector spinae muscles, your pelvic floor, and your diaphragm, you can get this core cylinder that can engage really well and basically stiffens the entire spine, which is a very mobile area, which has to be mobile for us to be able to walk and do all the movements and stuff that we do. And I find that it becomes discoordinated, either on too much, where you develop this high threshold patterning where you turn on the muscles like as hard as you can all the time, which means you become discoordinated with any activity you do, or it becomes inhibited and it's not on at all. So you want to make sure that you get that core coordination back. Now, if you're somebody who does a lot of core engagement work, a lot of core exercises, you are going to be very prone to turning your core muscles on way too much, which is common. Have you ever seen that?
No,
No, I guess you don't do a lot of the PT part.
I don't do any of the PT part.
So I see it though a lot where
Like
somebody,
people that are planking for 10 minutes and
yeah,
yeah.
yeah.
I can only plank for a minute at a time, so no problems here.
Well, I always think it's funny when somebody will tell me that they can do something like that, and then they still think they're weak. It's like you're not weak. You're just not using what you have there well. And
Yeah.
I think that's a huge difference. If you can't coordinate your muscles, it's like all the work that you're doing doesn't matter.
Yeah.
It really doesn't matter. You can't pull to the front.
What's next?
The next big one is going to be regional muscle activation. I really like to make note of you want the muscles that are going to contribute to spinal control, like your glute max, your gluteus medius, your quadricep muscles, and then all the way up above it, like your latissimus muscles, your superficial rector spinae that span your low back and into your thoracic spine. You want to make sure all those muscles are activated and well coordinated as well. So the most common ones that we see from inhibition is first the transverse abdominis, and then second is going to be your glute muscles to get
And that's
inhibited.
the TA activation with the little marches that I've done before.
That would be for the core. And
Yeah.
then for the glutes, it could be something like we use what's called a modified bridge, where you really focus on just getting in your glute and not your hamstring. So you really want to make sure you get the muscles to fire in the glute without your hamstring becoming overactive.
I've had to do both of those, and I
Hey.
think they both work really well.
You do it well. Yeah. He's a model. He's a model.
It does
client
take
for it.
some coordination for both of those.
It does.
Yeah, the TA activation, I think, is extremely difficult to try and just focus in on just those muscles. And then same thing with the glute activation. You've got to activate your glutes without activating your hamstrings. And I think I certainly struggled with it in the beginning, and I think a lot of people would as well.
I think it's interesting though, is that every time that you have a recurrence of your pain, you have to do the coordination again.
Right.
Right. And that because it most likely either got inhibited or overactivated. So something about the signal got dysfunctional again. So you
Right.
just want to make sure that those happen.
Yeah.
The next one would be mobility work. I was very specific in not saying stretching.
Yeah. I still don't know exactly what mobility work means to you.
Yeah. Mobility work means to me is that you coordinate your available motion. Oftentimes when people think that they have a motion loss, they don't actually have a motion loss. It just doesn't feel comfortable for them to use the motion.
Right.
And so they get like blocked or stopped because they're just not coordinating the motion well. It's so funny to me. You can take and somebody can tell me that they can't touch their toes, and then you have them roll the bottom of their foot with the ball. You just give them a really large sensory input, and then they can touch their toes. What kind of
What changed?
what changed there? The only thing that changed was sensory input. And I think that that's like, so when I say mobility work, what I'm saying is that you're controlling the sensory input that you get, and you're controlling the motor pattern that you're producing. And those things work together to basically make it so you can own motion. If you're missing a little bit of motion, there can be because you have a joint that's irritated. Well, if the joint's irritated, you treat the joint. Traction, it's like the easiest way, and it'll feel better. And then all of a sudden you have the mobility again. That's what I mean by mobility work. Work means that if you do have a motion loss, you go after what caused it. You don't just stretch the crap out of it without understanding what structure you're working on. And I will get off my high horse off of that one, but it's really understanding like what's causing the motion limitation and getting it back. That's mobility work.
Yeah. And I think it just also worth mentioning that like you don't need to do all of these. I think
No.
a lot of people might listen to this and think like, oh, I've got, 10 things I can do to help my low back pain. No, like you find the one or two that help. You probably only need a couple of these to make you feel better. And then you can focus on long term after that.
I personally, like when I have an injury, I really only try to find one or two things, and then I do it over and over again.
Yeah.
The whole idea that you need 1,000 treatments, I don't understand that thought process, to be honest. Like the big idea is that if something is working really well, you don't have to progress it. You keep using it. Like it's just keep on going until maybe it's not helpful anymore, but that's rarely the case. Like if it's therapeutic at the start, it'll typically stay therapeutic
All the way through.
all the way through.
Yeah.
I think the part that people get mistakes on is they'll think that they have to progress the intensity of the exercise. They have to increase the sets and reps of it. And especially if it's like activation, that's not honestly true.
Right.
But if you do catch that there's like an endurance issue or a strength issue, well, that's just going to take much longer. Now you're looking at a runway of like 6 months to a year to correct it.
Yeah.
It's not short term. So if you get improvements immediately, you're having activation issues.
You need to understand the reason that you're doing it. And I know I've certainly struggled with this before where like some of my therapies and some of them I did need to progress. I think of like my shoulder back in the day, I was progressing internal and external rotation exercises to where I could do a good amount of weight with those. But initially it was like, I just need to do the 3 or 5 pound weight over and over and over again.
So you had actual strength loss. So like that is different, but it does. And even in that situation, the timeline is just dramatically longer. You're totally right.
But same thing, like if you're doing, glute bridges for activation, you don't need to put a 45-pound plate on your pelvis to do them.
No,
Like you're activating the muscle. You're not looking to necessarily build strength or progressively overload those type of things. So there's just a good difference to note there.
it's a good point. It's a really good point. The last thing that I always think of is for treatment, which can be maybe a little counterintuitive, is to go after the movements that provoke your issue. I think that it's often we have a movement that hurts us, and so then we become nervous to ever get back to it again. And I'm not saying you have to load it to the exact same amount that you did when you hurt yourself, but I really don't like to leave motions that are dangerous and unconquered, if that's a good way to say it.
Yeah, like I think a lot of people are afraid to deadlift. A lot of people are afraid to deadlift because they hurt their back doing it one time, probably with a poor movement pattern. When, in all honesty, as long as you're patterning it right and using the right amount of load,
Should be fine.
it should be fine. Yeah.
And in those situations, that's where we've used the term key sign before. We haven't mentioned it today, but that's a really common key sign for the low back would be trying to touch your toes, extend your back, lean side to side. If any of those become worse during like your progressive increasing load, that would be a sign that you don't want to push weight that day. And so there are tools around that one as well. But it's also okay if you don't ever go heavy on deadlifts, but you should be able to do the pattern
Right. Or, decrease the load, put less weight on the bar, or move to a kettlebell or a dumbbell deadlift.
to where you just feel good.
Yeah.
Exactly.
I think we also wanted to just talk briefly about the therapeutic gap. We've got a cool episode on the therapeutic gap. Feel free to go back and check that out. What does the therapeutic gap look like for the low back when it's something that you use every single day in normal day-to-day activity?
For the therapeutic gap with this situation, the fact that it keeps coming back, we know that they never maintained the gap all the way to where their tissue capacity matched their physical capacity, so you stayed vulnerable. And there's sometimes where I actually think you can't. I think it's the tissue actually gets changed enough that you may never be able to fully say, "Hey, I never have to worry about my back again." And I totally understand that. The idea of maintaining the therapeutic gap is that at the beginning, when you hurt your back or you have a new exacerbation, it's really easy to manage the triggers because your feedback loop is really strong and it can tell you immediately that you did too much. And it's really easy to know which treatments are helpful because you'll feel better right off the bat. So, pain is actually extremely useful during the rehab process when we first start because it helps to tell you what things you need to keep doing and what things you need to stop doing. As you move through it, you start to lose the feedback loop, you start to lose your symptoms. And also, as part of the process of rehab, you add back in triggers, you add it back in things that were hurting you. Like that's a normal process, right? The other thing that happens is you stop doing the things that make you feel better. And so you go from having treatments are much higher, you're doing way more of them, you're doing a lot less triggers, and you start to narrow the difference between those two. That narrowing that you're doing, you're closing down your therapeutic gaps. You're no longer creating an environment where the tissue can heal and continue to improve. All I want to say on that is that you want to maintain that for as long as you possibly can, because I think it gets you a better setup where your tissue capacity gets as high as it possibly can. Because if you close it early, which I would say that's 99% of people who get used to having crappy back pain and they're used to just kind of feeling stiff all the time, they they think it's almost kind of hopeless to make themselves feel better. And because of that, I think that they quit doing things that can make them feel better for a long period of time. And they don't want to continue doing their home plan. Hey, because I get it. It's irritating to do traction daily. I get it. I also can get that if you really like to lift in the morning, it can be really irritating to have to exercise at night. I get that. But those are things that you can do. And if you could do it for a long enough period of time, you may get to a point where you're not going to have this same level of recurrence.
Yeah, no, it took me so long to wrap my head around the concept of the therapeutic gap. And now that I understand it, I mean, you talked about traction. When I first hurt my low back, I was kind of so debilitating at the time that I was willing and able to traction every morning. Like every morning, I'd go basically right when I woke up. At that time, I had a nice little home gym, and I would just go and do my traction for 5 minutes. And it was like, that's just how I started my day for I don't know, 3 or 4 months before I was able to kind of ease off of it because it wasn't creating as big of a therapeutic gap. It was something that I started to do as needed after then. But just the concept of increasing your therapy while decreasing triggers, like that in itself took me so long to understand that like this, it finally, like, the light bulb went off in my head that, okay, if I stop hurting myself and start making myself feel better more, I will overall have less injuries, which hasn't fully been the case just yet, but we're working towards it still.
Well, and that's the piece. The body inventory is really useful to help you remember that. But I always kind of think of it as you're going to stop getting the signal to keep doing the things that make you feel good. And you're going to start losing the signal that tells you to stop doing things that make you feel bad. And there may even be the case of those aren't actually triggers anymore. But what I like to look for is things that were feeling good. And they may go from like, wow, that really made me feel good to you don't really feel anything. It's probably still having a therapeutic impact on your back. And so for as long as you can, or like how you did, maybe you go from every day to every time before you work out and every time after you work out, you want to integrate those into maybe your warm up or your cool down long term. And I found that to be extremely helpful in reducing the level of recurrence. Because once you have this issue with your back, your recurrence is always going to be higher than somebody who's never had it, right? So it's always going to be elevated. You're going to be prone to it for a variety of different reasons. And that's where like the therapies that help, the things are actually treatments that improve your tissue capacity. You want to make note of what those are because you're going to want to go back to them over and over again. And in my strong opinion, you want to make it something that's permanently part of your system.
Alrighty. I think those are kind of the two goals that we want folks to take away when it comes to low back pain is, increase your treatments, build your tissue capacity, and reduce those triggers so that in the end you can build a stronger back or a back system or however you want to phrase it. You can find links to past episodes and related videos in the show notes. Quick plug, if you want to get yourself feeling a little bit better or have a specific issue, go ahead and check out smithperformancecenter.com. That's Craig's physical therapy clinic. I don't think we've plugged it enough in this podcast, but his
Thanks, we
clinic
haven't.
does a great job of helping me. And I know they've helped hundreds and probably thousands of athletes over the years that they've been around. So stop chasing pain, build some capacity, and learn how to keep it.
PYP, baby.
Peace.